Our workload has been a lot higher, for sure. I would say that it's been the busiest that I've probably seen.
Charlotte Thomas is a critical care nurse practitioner in the intensive care unit at Scripps Mercy Hospital in Chula Vista.
Usually by the time I see people, they're really in distress. Patients in the ICU tend to have a higher mortality than other areas of the hospital. COVID obviously has an exponentially higher mortality than our average. So yes, a tremendous amount of our patients have not survived the hospitalization.
Thomas is from Indiana. After high school, she enlisted in the Army and served as a flight medic on helicopters, later deploying to parts of Europe in the late 1990s. She says she's always wanted to help people.
This is my passion, and this is what I love to do, and I cannot imagine doing any other job, honestly.
Thomas says the core of her job, taking care of patients, has not changed, but now she does it with a lot more protective equipment. The pandemic has impacted her in other ways.
It's emotionally difficult to see people be that sick and to have to try to care for so many of them. Also to have to become the part of the patient's extended family and communicating with their families. So it has changed from that perspective.
Thomas moved to San Diego about a year and a half ago with her family. Her husband is a nurse practitioner in the Navy, and she has 3 daughters.
My family has adjusted the way that we have a nighttime routine, and they give me a good 20 or 30 minutes before they kind of talk when I get home, and just gives me a chance to be home and be present.
To relieve stress from work, Thomas says she likes to be outdoors.
Early morning runs, walks with the dog, things like that are nice. My kids will often go on the walks and things with us, but and my husband and I, we sure enjoy a good Netflix series just like the next people.
While the pandemic has been challenging, it's the patients that recover that help keep Thomas going every day.
And those are my favorite, the people that get better, and then we play a song overhead, Here Comes the Sun, when they leave, and we will line the hallways and clap appropriately social distanced, of course. Those are the best, when people get better and they actually are able to leave and go back to functioning quality lives.
We spoke to Thomas on the day she was getting her coronavirus vaccine.
It means everything. So getting the vaccine today is not just for me or for my family or for my neighbors and my community, but it's for the entire world when we get vaccinated.
She says to get back to normalcy and not overwhelm the healthcare system, San Diegans have to wear masks, avoid crowds, and stay home when possible. Matt Hoffman, KPBS News.